How does a cerebellar stroke affect the vestibular system? Imagine your balance and coordination as a finely tuned orchestra, with the cerebellum acting as the conductor. When a stroke hits this area, it can throw the entire system into disarray, especially the vestibular part that helps us stay upright and oriented. The vestibular system includes parts of the inner ear and the brain that work together to keep us balanced and aware of our position in space. A cerebellar stroke can disrupt this delicate balance, leading to symptoms like dizziness, vertigo, and difficulty maintaining stability. The cerebellum gets its blood supply mainly from 3 arteries: the superior cerebellar artery, the anterior inferior cerebellar artery, and the posterior inferior cerebellar artery. These arteries also supply nearby structures involved in balance and hearing. When a stroke occurs in these arteries, it can cause ischemia, which is a lack of blood flow, damaging parts of the cerebellum and the pathways that process vestibular information. This damage can affect both the central parts of the vestibular system, like the cerebellum itself and the brainstem, and the peripheral parts, such as the inner ear and the nerve that carries signals from it. Central vestibular dysfunction happens when the cerebellum or brainstem cannot properly process sensory input needed for balance and eye movements. This can cause abnormal eye movements like gaze-evoked nystagmus, where the eyes drift and then quickly correct, or impair the reflexes that keep our vision steady during head movements. On the other hand, if the stroke affects the inner ear or the nerve connecting it, it can cause peripheral vestibular loss, leading to symptoms like a spinning sensation, imbalance, and difficulty focusing during movement. People with cerebellar strokes often report sudden dizziness, vertigo, and trouble walking or standing steadily. Sometimes, these symptoms are accompanied by other neurological signs such as weakness, coordination problems, or speech difficulties. Because the symptoms can overlap with less serious inner ear issues, doctors relying on careful examination to distinguish between central and peripheral causes. For example, gaze-evoked nystagmus and coordination problems are more typical of a central stroke. Diagnosing a cerebellar stroke quickly is crucial because early treatment can improve recovery chances. Imaging tests like magnetic resonance imaging help identify the affected areas. Treatment focuses on managing symptoms and promoting brain recovery through physical and vestibular therapy. These exercises help retrain the brain and improve balance, reducing dizziness and preventing falls. In summary, a cerebellar stroke can significantly impact the vestibular system by damaging the brain's central processing centers and sometimes the inner ear structures. This results in vertigo, dizziness, and balance issues. The specific effects depend on which arteries are involved and how much damage occurs. Recognizing these symptoms early and starting appropriate rehabilitation can make a big difference in recovery. If you or someone you know experiences sudden dizziness or imbalance, seeking medical attention promptly is essential. Always consult healthcare professionals for personalized advice and treatment options.